Well, welcome back to Let's Have Lunch, episode 14. I hope everybody's having a nice, religious or spiritual weekend if you're celebrating Passover. I think we're on day 3, and I know Easter's tomorrow. So, welcome back. Today I thought what we would do is talk about some things that types of questions that we're answering all of the time, and that has to do with complications, risks, what to do to potentially avoid them. And because we've been talking so much about Botox and fillers, we're going to stay in that realm, and I'm going to quiz Karen and Karen. We're here today with Karen Lynch and Karen Whitney. Hope is taking a little hiatus, spending some time with her family. And so let's start with Botox. Let's talk about Botox a little bit. And so first of all, in preparation for a treatment, Karen, is there anything that you advise somebody to do or not to do getting ready for their appointment?
Definitely. If you can avoid blood thinning medications, Advil, Aleve, ibuprofen, maybe arthritis medicines, anti-inflammatory supplements, avoiding those for 48 hours ahead of time will help minimize your risk for bruising. Because anytime we poke a needle through the skin, we are, of course, looking to see any visible blood vessels, but we really can't tell what's beneath the surface. So avoiding blood thinning medication, they say avoid alcohol. I tell patients it's okay to have a drink or a glass of wine the night before, but don't have a party because that will increase your risk for bruising. Also, it's fine to exercise in the morning or day before you come in to see me, but anticipate that after I treat you, it's better not to exercise for the rest of that day or to have exposure to extreme heat. Those things dilate blood vessels and can increase your risk for bruising.
Is there anything, Karen, that somebody can actually take to minimize bruising?
Well, some people think that oral Arnica montana, which is a herbal supplement, it's a plant-based tablet that you dissolve under your tongue or take orally. For some people, taking Arnica ahead of time does have an anti-bruising effect. There's no hard scientific study on that, but it's been used for years.
Okay. Yeah, I know that patients years ago used to come in and they would ask me if they could take Arnica, and of course this was a long time ago, and being a little bit, I don't know, ignorant possibly, I didn't really know what it did, and I told them to stop. Then for a period of time we would give Arnica to our surgical patients. They're little tiny tablets and they're really difficult to take, so they became challenging for some people. And honestly, I'm not sure. I know there's research on both sides of those things. So, but the best thing to do, Karen, then is really just to avoid aspirin and ibuprofen. What about vitamin E, grapeseed extract, ginkgo, those types of things?
Yeah, supplements like fish oil, vitamin E, turmeric, any of the anti-inflammatory supplements in theory might have a blood thinning effect. The challenge with something like fish oil or vitamin E is that it is a fat soluble vitamin, so it actually takes quite a while to get out of your system. But I usually tell patients if they're able to avoid those things for 48 hours ahead of time.
So I come in, I've had my treatment. Maybe you could go through, so if you're talking to me about treating, let's say I have, and I do, and I need some Botox, it's been quite a while here, these deep rhytids or wrinkles in my forehead.
Mhm.
Given that you're treating me, a male, right, with brow position and the whole thing, what is your approach? What do you tell me? What are you trying to avoid?
Well, what we're trying to do, the frontalis muscle goes from your brow up into your forehead and it lifts. So when the frontalis lifts, it can cause creasing lines of the skin. So we want to relax the lifting action of the frontalis, but not to the point that you can't move, although some people do request a frozen look. But what we want to be careful of is that we don't drop the eyebrow, because these muscles are lifters. And if you stop the lifting action too much or too close to the brow in some patients, myself included, you get this effect. Now, with men, we're looking at where's the hairline, because if you have some deep lines, say right in the very middle of your forehead, and we relax just that portion, and then when the patient lifts, sometimes you'll still see movement pulling up above their hairline. You can also successfully relax this, but allow too much brow lifting, and then you get this funny, surprised, Spockish kind of look. It's actually easy to fix that. And we can always adjust. Usually we bring patients back at 2 weeks. How did we do? Do I need to tweak it or adjust it any? I can't reverse the Botox, so I'm going to risk undertreating and needing to put some more in rather than risk overtreating, which I can't correct. So we want to be sure that what you end up with is, if there's remaining movement, we want it to look natural, even, not give you any funny expressions, and also not leave any funny pulling in the forehead.
So, okay, so you use your technique, and the expert that you are, you probably never have any complications at all. I know that my wife tells me that I'm perfect all the time, but
Good for you.
what do you like? What do you? Right. Well, good for you. Yeah. Usually, if I ever say that to patients, they'll say, "And you believe her?" So, but anyway, okay. So, all right. So you know how to do it. You know what the action of the muscles. You know what you're trying to achieve. You communicate that with patients. But okay, so whether or not they were active or rolling around doing their yoga or doing some of the things that you might have advised against, let's say they followed everything, because most of our patients do, but let's say that brow comes down a little bit. What can you do for that?
Well, one, we're going to look at the frown muscles in conjunction to the forehead muscles, because they're working together. Frown muscles typically pull down and in, forehead muscles typically lift. So I want to make sure that the balance between the two muscles is appropriate. But if someone does get a little bit of heaviness, sometimes we can put a little drop of Botox, a unit or two, out in the tail of the brow, because there's a muscle, the orbicularis, muscle helps pull down in, and so sometimes relaxing that a little bit will help elevate that brow. Otherwise, usually what's been placed there is a small amount, only a couple of units, and so often it'll even itself out over a 2-week period as the muscles work together and the Botox has its full effect. Otherwise, it usually does wear off within a couple of weeks.
So what I'm hearing you say is, if that occurs, generally, because you're not treating with a large number of units, it wears off, and it's more supportive therapy, just kind of letting you know that that it's going to improve. This thing with a tug of war between the frontalis muscle that you just described as an elevator and the orbicularis, which is a depressor. So what you're saying is that if we weaken that orbicularis muscle, then it might allow this to pull up a little bit. And in fact, that's how you're achieving a non-surgical brow lift very often, right? Isn't that one of the most popular things that people are coming in for?
It is, because in women we prefer that brow to sit a little bit higher than the rim of the orbit. A lot of women do request a brow lift. The other thing is, as this upper eyelid skin gets a little lax and can look heavier, someone might like their brows a little bit higher, so that there's less skin showing, extra skin showing here. And the way we get a brow lift, every injector does work just a little bit differently in their approach to treating the face, just as each hairstylist might handle hair a little differently, or a workout trainer might approach your fitness regimen a little bit differently. But what I like to do is relax the central part of the forehead and leave the kind of a pumpkin, I always say like a pumpkin brow above the eyebrow area, leave those muscles active, because that, relatively speaking, makes this muscle stronger, because these muscles are a little bit weaker. Also then relaxing in the upper portion of the orbicularis helps open up the eye and open up your brow.
Okay, great. So let me ask you about two more things that that can happen. We'll start with the one that's probably the most common potential complication, and that is bruising. Right. So tell us about that, and how to try to avoid it, and what we can do if it does occur.
Mm-hmm. So yeah, unfortunately, anytime we put a needle through the skin, there's a risk for bruising. So as I'm treating, I'm looking very closely to avoid any obvious surface vessels Sometimes I still catch one. Also, sometimes we're still catching a vessel underneath. Probably the crow's feet area is more common. There are a lot of vessels in the frown muscles, but that's a very forgiving area. A bruise there is unusual, but also because the forehead is so thin, sometimes we'll catch a little vessel. Often we'll use, if someone says they bruise a lot, we'll put ice on the skin before we put the needle through, because ice constricts blood vessels. So the chance of hitting that smaller vessel is less. We also like to apply ice afterwards for someone who's prone to bruising, and we should offer you ice. And a lot of patients say, oh no, I don't need it. But other patients are happy to accept the ice, and just icing the area over the next hour or two helps minimize bruising risk. As I said, avoiding anything that would dilate the blood vessels. Anytime we've done Botox, we don't want you getting a facial massage or going into a massage chair for that day. We don't want direct pressure or manipulation of that area, really, for the rest of that day. So if you get a bruise, usually they're small, they'll usually go away pretty quickly, and they're typically concealable. We do have a light-based treatment called IPL. It stands for intense pulsed light, and the IPL can be applied to your bruise. It's a quick pulse. It's like a little snap. There's no downtime with it. It really literally takes us about 2 minutes to do the whole treatment, and that will help break up the pigments of the bruise quicker so that everything looks better faster.
Okay, great. So I think this next thing probably has never happened to you, so I think I'm just going to talk about an experience I had. You know, as you know, we started the practice about 20 years ago, and about, I don't know, 15, 16 years ago, had a patient come in. We treated the glabella area, the frown line area, these 11s, and so just like we talked about with the forehead area, where that some of those, so that you've got several injections that occur, and the Botox can diffuse a little bit from that area. Well, in the glabella area, well, this could happen with the forehead as well, but in the frown line area, if we inject, if some of that Botox potentially could drift down into one of the muscles around the eyelid, and that's what we call an eyelid ptosis. So let me use the words ptosis. So the brow ptosis, before Karen talked about, is the brow dropping. An eyelid ptosis is where you look like maybe you've had a stroke, where half of your eyelid is maybe lower, it's down lower. And so I'll tell you the story. So, you know, doing my thing, running around, treating Botox, talking to patients, and, you know, lo and behold, the patient comes in I haven't seen for 6 or 7 months, and I just said, you know, how are things going? And she said, well, they're going pretty well, but I got to tell you this, I was worked up for this neurologic disorder. And I said, oh, you know, I mean, that's pretty serious. As she started talking with me, what had happened is that I treated her, and secondary to the Botox, so a little bit of that Botox drifted in, and so her eye looked more closed, an eyelid ptosis, and so she went to her primary care doctor, never talked about having Botox at the time, and she was worked up for these neurologic conditions. So, I mean, that probably is the worst case scenario. What do you do if that occurs? First of all, it generally does not last very long. It's a terrible complication, because when you're communicating, you look at your eyes, people communicate looking at your eyes, and it's clear that there's a problem. It does go away. Usually it goes away within a couple of weeks. Again, there's usually just 1 or 2 units that's affecting that muscle, a very small amount. There are eye drops, something called anopidine, and some other eye drops that compete with the Botox, so that may help, but it doesn't do a lot, and it's really a waiting game. If that occurs, and it occurs very infrequently, but for me, and again, you know, there's no study to document this, but it seems to me that when that occurs, it occurs if there's been maybe a large bruise in an area. And what I think is the Botox is injected, now there's a bruise, and so there's more blood, right? And so it allows the blood to carry that Botox maybe into that eyelid muscle. So That's called an eyelid ptosis, different from the brow ptosis. Okay, we talked about bruising. And I just think it's important that we talk about some of the problems that we can see. That really is an exceptional problem, but I didn't want to leave it out of this because that's probably one of the more devastating ones. Had this patient said something to me or called back and asked, obviously she wouldn't have had to have been afraid that she had some neurologic problem. So, okay, let's move to fillers now, Karen. You do a ton of Botox, you do a lot of fillers, and these are very common things. So maybe, we started talking a little bit yesterday or the other day about fillers and technique. And maybe for a moment, because I don't think there's an absolute better way or not, but can you talk a little bit just about the philosophy of how we inject with needles versus cannulas and just the approach to the anatomy of the face?
Yeah, I'd be happy to. So as you may or may not know, fillers are hyaluronic acid. It's a smooth gel. It comes in a sterile pre-filled syringe with suggested needles for injecting it. Voluma is used in the cheeks, and it actually does now have FDA approval to be injected with a cannula. Otherwise, we're using needles or cannula off-label. And we refer to off-label, that means it's not according to the exact FDA approval, but if you're appropriately trained, it's the standard of care and what experienced clinicians are doing. What's interesting about injecting filler and the technique for filler is that most areas have more than one good technique. So each clinician is going to choose the best technique to get best results in their hands. So for example, if we're lifting a sunken temple, we locate the appropriate position, inject the needle, and it sounds kind of awful or weird, but literally I place that needle in so slowly that when it's right at the bone, I can feel it barely touch the bone, and I'm placing a bubble or a bolus or a pillow, if you will, of lifting filler in one position right there to lift that muscle outward. We're often using that same direct injection technique in the cheeks. That's very different than what we do in the nasolabial or marionette folds, where we're using the needle going parallel, level with the skin, and placing the product right in the layers of the skin for a smooth lifting line. We might use a cannula, which is a rounded tip needle, when we want to get the product someplace we don't want to poke a needle. So for example, the under eye area is very common concern for patients. There are a lot of blood vessels there. You're almost certain to cause a black eye if you do one or two pokes up in this area, but we can pinch the skin of your cheek, make a little poke through that little stick mark, and this is why I'll wear magnifiers so I can actually find that little hole. You put the cannula, which is a rounded tip needle, and that little rounded needle can move safely under the skin. There's very little discomfort with that, and it allows us to smoothly put product where we don't want to put a needle. We'll also do that along the jawline and sometimes in lips as well. So sometimes we're using a very small needle going straight in, putting small bubbles or aliquots or boluses of filler along the bone for better lift and support. Sometimes we're fanning filler in underneath the skin to restore volume. Sometimes we're doing what we call a retrograde injection, and that means we go through the skin, advance the needle to where we want to start the filler, and as the needle's coming out, we place little lines of the filler product. So each area has its own peculiarities in terms of what might be required to get the best correction.
Okay, yeah. So, it seems like a lot to do, maybe about nothing, but it's super important. There are a lot of studies. Karen is a national trainer for Allergan. She trains other physicians and nurse practitioners and physician assistants around the country with the best techniques, and it is a big deal. And I'm not putting any category of people down at all, but as Botox and fillers have become more mainstream, more popular, you do see dentists who actually are commonly good surgeons, but you might see hairdressers, you might see anybody, injecting Botox and fillers. And I could probably teach many of you, as Karen could, some of the proper techniques, but the biggest risk to is not understanding the facial anatomy. And the reason why we're talking about cannulas, what's the big deal with a cannula? I don't care. I want you to use a needle. I want you to use a cannula. Well, that's not the decision. The decision is we don't want to inject the product, the hyaluronic acid filler, into a blood vessel. Why? Because that would block the blood flow, and anything distal to that, anything beyond that, potentially then could be jeopardized. It could become necrotic, right? Or in the worst case, there have been reports of blindness in certain areas when people are injecting in certain regions. So this is a very serious proposition, and it really requires an experienced injector, somebody who understands the anatomy and understands your anatomy specifically in terms of what we're trying to achieve, and thinking through the process to best achieve that. We have not had any blindness or any problems like that, but we have seen some blood vessels occasionally become disrupted, and there were no long-term results with that. But it's a very serious thing to consider, which is why we're talking about complications, and why you should see people who are experts in this area, like Karen and Hope. Karen, did you have any comments on that? Sorry.
I do want, so I would like to make sure patients understand that every time I'm placing a needle under your skin, into your skin, injecting filler, I'm thinking about safety first. I'm thinking about your anatomy. I'm thinking about where are the important blood vessels? Am I in safe treatment zones? And this is really a key component of the training that I take to other offices, is how to get the results we're trying to accomplish in a safe manner. Teaching the anatomy, where are the important vessels, nerves that we're avoiding. One thing you're probably very unaware of, because sometimes as I'm treating you, I'm chit-chatting, I'm trying to distract you, because I know it's a little bit uncomfortable, but part of my brain is always very focused in on what I'm doing. Each time I'm placing a needle into your skin, before I start pushing the filler in, I pull back a little bit on that syringe. What we're looking for is what we call flashback, because if you've had your blood drawn, you know, they put that needle in and you see the blood kind of pop at the end of the needle into the vial. That's flashback. And I'm pulling back on the syringe. Every time I poke that needle in, I pull back, make sure there's no flashback of blood, because that's one way of ensuring that I'm not in a blood vessel. So please rest assured that everything I do is geared towards a very safe outcome. And it's important. I know exactly what to do if something does go wrong. You can't inject as much as I have without at some point causing a blockage of a vessel. And it's kind of nice to know that my instincts are to immediately respond appropriately.
Yeah, and Karen, let me jump in for a sec and say that the other really important thing, so we're talking about these potential risks. You also need to be prepared, and so, you know, we've talked other times about hyaluronic acid, these HAs, the Juvederms and Restylines and Volumas and all these products. They're soft, they're malleable, and we've talked about them being easy to reverse. And so there's an enzyme called hyaluronidase. Let's say there's something that you don't like about it and we want to reverse it, we can. But more critically is that we have the appropriate volume, the appropriate amounts of hyaluronidase ready should we ever be in a situation where we need to reverse it because one of the vessels was occluded. So, so for a lot of reasons, I would say probably more so with fillers than Botox, it's really important that you're seeing somebody who has experience and understanding with this. Karen, let's just do one more thing about fillers, kind of in the same realm. So talk to me a little bit about, so, you know, excuse me, you're treating patients, there is some irregularity, not irregularity, maybe there's some fullness or a bump or something. How do you manage that? So you go home, it's 4 days later, you realize, oh my gosh, it feels more full on one side. What do you do for that?
Yeah, that's a very good question. So one thing, when we place filler, you may or may not have some sensation of swelling, tenderness, fullness. You might have bruising, which causes swelling. So it's important to choose your injection date at a time you don't have something important, either socially or but I don't know, maybe 20% of patients get a bruise. So we like to do a 2-week follow-up. And the reason is that I'm placing the filler. It may cause some bruising or swelling. The filler itself is hydrophilic. That means it's going to pull water into the area. And say we put some filler into a marionette line. It's really common for that to feel chipmunky or bulky or full. And it may look okay, but it's going to feel swollen and maybe even tender. It takes anywhere from a week to 2 weeks for that to quiet down, for your body to normalize with this newly placed product. But if you do come in and it's been 2 weeks and you say, Karen, it just feels a little lumpy here, or it looks a little lumpy, the first thing I'm going to do is massage the area. Because these fillers are hyaluronic acid, they're malleable, we can contour and shape them. I'm going to push, massage, work that area, and typically that takes care of it. In the event that it still doesn't quiet down and it's been 2 to 4 weeks and there's still something you're seeing or feeling that we don't like, we can actually put a drop or two of that hyaluronidase in to have a softening effect on the filler. So that's fairly common. If we're injecting lips, sometimes because the product is fairly close to the skin, patients will feel a little bubble or feel a little bit of irregularity. That usually smooths itself out. But if it doesn't, or if we have a little fullness in the tear trough area, we can massage it and smooth it.
Okay. Well, good. Can you think of anything else that's common? I know that we've covered a lot of ground. Karen Lynch, I don't know if you're still with us. Do you have any questions for Karen or me? Or not?
Yeah, I was just going to say, one of the big questions I get is how we charge for these products. And I know we were going into complications, but maybe just a little bit when you talk about putting like a little bit here and there, how we're charging for that and why we charge the way that we do.
Okay, Karen, go ahead.
Sure. So one thing I would like to mention is while it's very uncommon based on the number of patients we see, we occasionally have someone call and say, you know, I got my filler, it's been 6 months, I just got over the flu, and where the filler is a little bit tender and swollen. And with the Vicross fillers, Voluma, Volor, Volbella, while it's very uncommon, we do see, I think it's maybe 1% or less patients who might have this delayed swelling reaction. Medically, it's not serious. It's just we work with you to make sure it quiets down. That might involve massage. It might involve taking an anti-inflammatory. It might be that we use a little bit of that hyaluronidase and soften the filler so that things can normalize. Infections are extremely rare, and this kind of delayed swelling is not an infection. It seems to be that the filler's taking on more fluid in response to your body's own immune reaction to dental work and illness, maybe minor trauma. So I'd like to mention that in case you've heard, oh, I heard that you can get swelling down the road from filler. That's what's going on there. It's still not completely understood, but something triggers your body's immune system as a normal reaction. And then in rare cases, that filler might react a little bit too. So that, I wanted to mention that. And then pricing is based on the product we're using and the size of the syringe. Volbella, which is very soft, used tear trough, very fine lines, lips, lip lines, does come as half a cc, and the other products all come as 1 cc, and Volbella comes as 1 cc as well. So a half a cc of Volbella typically is $390. We do like to use a whole syringe when we treat you. In the past, the filler composition was a little more straightforward. We would sometimes carry a syringe forward for you, use part of it, keep part of it. We really don't like to do that anymore with the nature of the products we're using. So when you're in, we like to use that full syringe. And you might feel like, oh my gosh, I don't need that much. Remember, 1 cc is 1/5 of a teaspoon. So if you've got a little correction on your lines, from nasolabial lines, and we don't use quite all of it, we'll put a little at the corner of your mouth, or maybe a little bit along your jawline. So it's very easy to use that volume. The longer duration of filler tends to cost more. So the products, the Juvederm Ultra, Ultra Plus, standard price is $640 a syringe. It lasts about a year. Go up to Voluma, which is what we use in your cheeks, last up to 2 years. And these numbers are based on FDA. We see variation, but that product starts at $940. Now, of course, we have our rewards program. We also run promotions. We also work with Brilliant Distinctions. So there are many ways to bring the price of that actual syringe down. Does that help, Karen?
Yes, that's great. I know that's one of my biggest questions that we get at our office all the time. So thank you.
Yep.
Yeah, with Botox, just as you guys are saying that, well, with some of these things, and Karen, I'm not sure if you said this or not, but with that 2-week visit, that let's say you're coming in for Botox for the first time, you know, it's up to us to discern how much Botox we think you're going to require. I know sometimes there's unit pricing. Generally speaking, if we're treating you with a normal dosage that is around 20 units ish, and you come back and you need more, generally there's not a charge for that. But we'll have another discussion about prices and how to how to make your money go as far as it can with regards to non-surgical treatments. These things last a long time, at least the fillers do, and we want to get it right. More importantly, you know, they say quality is remembered long after price is forgotten, and and that should be true really of anything. But anyway, all right. So I don't know. I'll have to talk to my team here. I think tomorrow I might be solo or say hello, or maybe we won't be on. I'm not sure. But happy Easter to everybody else, and look forward to seeing you again. Thank you.
Bye.
Bye.